Hey guys, Dr. Coyle coming to you again from Coyle Institute. And today I've got something really special for you guys. We're trying to get more information out there about the diVa and the diVa Tight and what to expect. And so I actually have a patient interview of a patient that's getting ready to receive her first treatment. And we're going to go over some of the what's to expect with the diVa, kind of during the diVa, after the diVa, as well as the diVa Tight. And she has some really good questions as well. And so you guys, come on, let's take a look. So today you're here for your diVa. Also, we're going to be taking a look to see about doing the diVa Tight on you. And so what I want to do is I want to tell you kind of what to expect. All right. So from the diVa, the whole idea of this is we're going to be using the laser to treat the inside of the vagina. So typically when we first came out with the laser, we would do just one pass. Well, if we're doing this for like urinary incontinence or something like that, we've actually developed, or I've actually developed a what we call a focus pass, where I'm going to be focusing on areas that we're trying to correct in you. Okay, are you having any issues with leaking urine or anything like that?
Yes.
Okay, so specifically with you, we're going to be doing one full pass with the laser. And when I talk about doing a pass with the laser itself will actually rotate and back itself out, and so that's kind of one pass. So we're going to do one pass using the deeper laser that treats that collagen, the blood vessels, and the nerve endings. And then the second pass is going to be underneath that urethra, really trying to improve the tissue underneath the urethra. And then we're going to do a third pass, treating 360 degrees the whole inside of the vagina again. Okay? We do expect you to have some bleeding from this. Okay? That's part of it. We want to make sure we're getting to where that blood vessels are. So some of the things to expect during the procedure, you've got some numbing cream inside now. The first pass, you're really not going to feel hardly anything. The second two passes, going to feel like a little man in there hammering. And it's usually people, they tell me that's exactly what it feels like. And then we'll do both the passes. Afterwards, once we're done, any feeling that you had typically kind of goes away. It's no big deal. We do expect you to have some bleeding. Some people bleed for a couple of hours, some bleed for a couple of days. Okay, so everybody's a little bit different. In addition to that, we used to recommend waiting about 24 to 48 hours before having intercourse. Truth of the matter is since we're doing more passes with the laser, we're going to recommend waiting more like 7 to 10 days, okay? Because you're going to have some swelling in there. If you try to have intercourse, it's going to be too tight and it's going to be uncomfortable. And so let that swelling go down and then you'll be fine. Okay. In addition to that, you also may feel just a little irritation kind of inside the vagina, especially underneath the urethra, because we're treating underneath that urethra. And also about a week to 2 weeks down the road, you may notice some itching. That itching is not an infection, it's just your body healing. Keep in mind, we are creating small little wounds inside the vagina, and we want those wounds to heal. And so that's where that irritation kind of comes from. Very rarely, I have some people will say for the first 24 to 48 hours after having it done, they just kind of feel kind of like they have a little low-grade fever. And that's also just kind of the body's response to this healing process. You don't have an infection, it's just kind of going on. But then usually all that kind of gets better and things are fantastic after that. We're going to be doing a series of 3 treatments, 1 month apart. You come in, same thing, we numb up the inside of the vagina, do the treatments, and kind of go from there. All right? Do you have any questions, any concerns?
Do those symptoms intensify like at the second treatment or the third treatment? Or does it seem to get better?
Actually, that's a great question. It does seem to actually get better because as your tissue gets healthier, the symptoms get better. For example, people that have severe atrophy inside the vagina, they typically will bleed for several days after the first treatment. After the second treatment, they may only bleed for a day or so. So that does get better after each treatment.
Okay. So if I do get the Tighter today, can you actually treat the outside of the surface with like a lavender and coconut oil to help with the irritation or like cause infection?
Right, you shouldn't have any irritation on the outside of the vagina. Okay. Doing the skin tightening on the outside, all we're doing is we're using this handpiece, which is actually going to be heating up the tissue. We're trying to get it to 40 to 42 degrees Celsius. And so it'll feel kind of like getting in a hot tub. When you get into a hot tub, it's like, oh my gosh, it's really hot. But then we back down the intensity, and so it's very comfortable for you. And we do that for a period of about 4 minutes on each side.
Okay.
The other thing is that we're using the diVa Tight, or the skin tightening, to tighten up the labia, the vulva, but then also to improve orgasmic function and also urinary incontinence. So we will be treating the clitoris today. As a gynecologist, we always, do whatever we can to stay away from the clitoris. In this particular case, we're actually going to be treating the clitoris and the urethra today as well.
Okay.
All right.
So do I continue using my estrogen cream in between treatments?
I would recommend coming off of the estrogen cream and see what happens. Most of these ladies actually that we treat this, the whole idea is see if we can get you off of that cream. So I would say come off the cream and see how you do.
Okay.
Very rarely do we actually have to have women go back on their cream after doing the treatment.
Okay, so even after just the first treatment, try to just see how we do. Okay.
The first thing that we start to notice, actually, after this first treatment, women will come back for their second treatment, say the one thing that they notice the most is increased moisture.
Okay.
And then the urinary symptoms
Any
usually...
moisture would be good because I have none.
Yeah.
I have to use make-believe stuff.
There you go. Yeah. And so exactly. So most people will come back saying that they've really noticed a significant improvement in moisture. And then after the second treatment, they come in and say their urinary incontinence is a lot better and things like that. So,
wonderful.
All right.
Okay, perfect. I'm ready.
All right, good deal. Thanks guys so much for watching the video. I hope you got something out of it, and as always, keep in mind that we're here to help. And if you feel as though that you may benefit from something like this, or if you know someone that may benefit from having the diVa or the diVa Tight, then don't hesitate, give us a call.